It seems like there's a number of services within the Office of Community Care, and each one I think could probably be its own benefits breakdown. And maybe we can do that later on as we progress through the podcast. I'm just going to run through them real quick. From what I saw on the website, general community care, urgent care, emergency care, which we kind of covered in one of our COVID bonus episodes with Dr. Kessler, foreign medical care, home health and hospice care, Indian or Native American health services, in vitro fertilization, state veteran homes, and flu shots. Now, we're talking about care within your local community healthcare systems for all of these, and I'm sure eligibility for each differs a bit based on the service and the need. But what are the general eligibility guidelines for community care?
So some of those programs are fairly limited to certain populations, but I think the biggest program is just the general community care. And so there are certain criteria for that, which of course vary depending on where you live. But essentially, if you are in a state with no full service VA, if you need a service that the VA near you doesn't have, for instance, something like maternity care or neurosurgery, those are not necessarily available at every VA.
Okay.
If you've been grandfathered in through something from the Previous Choice Act, and then the access standards, which have to do with how soon you could get an appointment or how far away from that facility you live. So for instance, if you wanted to get primary care at the VA, but you lived an hour away, that's past the driving distance that we expect people to make. So if you can't get to the VA within 30 minutes, then we would give eligibility to be seen in the community. Now, that being said, people do choose to just come to VA and they do the extra drive, but they don't have to. And then the access standards around wait time is, let's say you need an orthopedic surgeon, maybe you could relate to that with the shoulder. And
yeah, absolutely.
Right. And then they tell you that the next visit's 40 days, right? That's too long. So anything over 28 days for specialty care would give you eligibility to go to the community. And then again, you could choose, because in some communities, maybe you could get in 14 days. In some communities, it might be a longer wait to go to an outside orthopedic surgeon. But the veteran is then put in a position to have choice. And that's the key to the legislation. We gotta get them one way or the other. Machine gun, fight, bullets fly, day and night rain.